You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Brand new topic on the show today, hair transplant surgery. What's new with us? We have a board-certified facial plastic surgeon, Dr. Gregory Keller. Dr. Keller, welcome to the program.
It's great to be here, Randy.
Now, is this in your specialty, by the way?
It is actually. It started in our specialty almost, and dermatology.
Okay.
Yeah, and we used to be a major part of the boards of hair transplant and societies that were there. And there still are a lot of us who do this type of work.
Okay. And this is a popular procedure for you.
It's very
in
popular.
Santa Barbara.
Very popular. It's been popular since 1976, which is when we started doing it.
All right. Now, are the techniques, have they changed over the years to make it a more authentic look as far as hair transplants?
Well, you know, Randy, I like to say it's not your father's hair transplant. Your father's hair transplant was, you know, the larger plugs. It looked pluggy. We did flaps for a while. That didn't look quite right. But now we use what's called the follicular units. That's the new technique.
All right.
And it looks completely natural and completely great.
Now, that's tedious work. And I've talked to a lot of doctors. They don't like to do it. Why do you like to do it?
Well, I like to do it because of the difference it makes in people's life.
Okay.
I mean, there are a lot of guys out there who like to look bald. And, you know, there are even people who shave their heads to look that way. And, you know, nothing against that. But in my mind, it's a younger, more vital look, particularly as you get into your, you know, say 40s.
Now with bald people, you say on the consult that, you know, certain people really are held back by their baldness. Tell me what you mean by that.
Well, it's the way they feel about themselves.
Okay.
I mean, some guys are perfectly confident when they're bald and they feel perfectly good about it, and wives or girlfriends are fine, and that's fine. But I think the average guy really doesn't like to be bald. He feels a little ashamed. He's lost his hair at a young age when everybody else had hair.
Yeah.
And, you know, that stuck with him for a while. And if you put hair on somebody's head, you know, it changes a guy so much that he just...
Well, they definitely look younger. I mean, if you give somebody their hair back, it makes you look younger.
Well, it makes them look younger, but it makes them look better, too, and they feel better about themselves. Women too. Women lose hair, you know, around the time of menopause, and they'll wear wigs and everything else to try and hide it, and they just don't feel good about it. And I think that that's a lot of what it is.
Now, I've sent you two people, by the way, over the years for hair transplants.
You have, yeah.
Both very happy. The one guy, David Palmer, you know, he's like a different guy now. I mean, he really is. I mean, he was held back by his baldness. He was one of these guys that every joke was about him losing his hair, and you couldn't talk to the guy for an hour without him bringing up some joke about his hair. And he always wore a hat. He said he hated wearing hats now, of course. And you know, after the transplant, I should tell you a follow-up, because I see him every once in a while. I don't know if you ever see him on a follow-up, David Palmer. And he said that he actually gets compliments about his hair. You know, and he goes, I go, are they being sarcastic? He goes, no, people will say I have cool hair. So now because he had an old-fashioned hairstyle before, because he had no hair. Now he's dressing better. He's kind of hip and cool now. Do you see? I mean, do you see that when people change their hair and all of a sudden they
an awful lot, Randy. Here's David, for instance, and he even did a little film for us that said, would I do it again? And he brushes his hand through his hair and says, absolutely. And I really think he meant it. He just feels so much better.
Yeah.
It's a relief almost for a lot of people.
He's growing it out. It's more like mine now. We're going to have to get a follow-up photo to this. And I said he's going to come down here and I'm going to interview him about it, because he truly thinks it changed his life. Even his wife. She's my really good friend, Janine Selby. And she says that he's a completely different guy.
It really makes that. It gives people confidence in the workplace, at home.
I mean, it's hard to believe, frankly, too. Because I'm very skeptical. I always think it's an exaggeration. You see these commercials, the guys are swimming and canoeing and hiking and all these other things just because they get their hair back.
Well, Randy,
I mean, it seems very hard to believe, by the way.
You know, you're a little insensitive to it. You've got hair. You don't understand how guys feel who are balding or bald. Okay. And they really are self-conscious about it. It really does not consume them, because they're normal guys, or, you know, and feel that way, or women who are losing their hair as well. Because that happens also. And it's really an inner feeling that they have. And you take that away, you give them hair, it really makes them feel good. And, you know, partners really respond to that. You know, we used to have a saying, you know, that we didn't mention on air or anything, get hair, get chicks, or get a partner, or whatever, you know.
Yeah.
And
get hair, get chicks. Okay.
Yeah, you know, it's not true, because it's the
But
way
it
that
is true if somebody's self-esteem, I guess, is compromised because of their hair.
Yeah, I think it's the way you feel.
Like anything else.
Yeah, it's not the way you look, it's the way you feel about the way you look a lot of times. And this really does make people feel better about the way they look.
Good, good, good. Okay, so with David Palmer, he goes in, and how long does it take? I mean, he goes to your office, the procedure itself takes what?
Well, you know, he comes into the office and we talk about it, and then what we do the day of is we draw what we're going to do in front and in back and sort of do an outline of the whole thing. And then the process is almost a microscopic type of technique. We can do one of two things. We can take a little strip in back of the hair that comes out and is hardly noticeable at all.
Okay.
You know, even your hairdresser a lot of times can't find it. And that we take the loose scalp tissue out with the hair intact. And then very tediously, and as I say, this takes a team, because we used to do, in the days of bigger grafts, maybe 30, 35 grafts was a big day. Mm-hmm. Now we're doing, and that's one of the new things, is up to 27 to 3,500 grafts, and really transplanting things all in one session.
Can you take somebody that really has, you know, a bald head and give them hair back?
You really can, yeah. It's sort of interesting. The key is the donor area. Do they have enough donor area to
The donor area is where? In the back, though, right?
Well, yeah, you notice.
But everybody has hair in the back, don't they?
Everybody has hair in the back, and this hair is genetically different from this hair.
So it doesn't come out?
It doesn't get, well, it thins over many years, but it's what's called male pattern baldness or female pattern baldness. There are different types of baldness, but essentially one area of the head loses the hair generally. And that male pattern baldness, those hairs are different hairs. They're genetically programmed differently. They don't respond the same to dihydrotestosterone, which is a breakdown product of testosterone. They respond differently. Okay. So if you take that hair that genetically is going to survive the dihydrotestosterone and put it up here, it still thinks it's down here, and it's still going to grow and not fall out.
What are the age ranges of people you see?
We see age ranges from the 20s. I even did somebody in their 80s at one
80s?
point. 80s, yeah, yeah.
Wanted to have hair.
Well, yeah, some people have those old plugs, and you know, we can revise that type of problem, pluggy look, and make it look natural.
Okay, so people that have plugs or that look, you could revise that, do a revision.
Yeah, we can revise that so that it looks much more natural.
Okay, and ideally, when should somebody do it? I mean, when do you do something about it? Because if you do it too early, what happens?
Well, people who do it too early want a different type of look that isn't going to stay with them for life. What we want is to plan ahead and to think ahead into the future. We want somebody to look like they always have hair and will always have hair. Now, in somebody who has a lot of baldness, you know, we want to, in their family, we want to get that pattern established so we can figure out where they're going to some degree. We want to get them on some Rogaine or Propecia or something like that to try and prevent the hair loss that, you know, otherwise would occur.
Okay.
And then we want to look ahead. Say somebody's bald and has a very small donor area. What we may do is just put a tuft of hair up in the front that tapers back. That is a natural type of pattern that'll frame the face and make them look like they have hair.
Okay, this guy right here. I mean, he was pretty much bald on the before. After is a phenomenal result. Tell me this. Tell me what you did for him.
Well, if you look at him, what we did was we transplanted the front a little higher than we normally do, but he has a pretty good donor area, and this pattern that he has is pretty well established. I mean, we know what it is.
When you say pattern, what do you mean?
Well, pattern of baldness. You know, some people have a little area of baldness. Some people have a bigger area.
He has a huge area, baldness, it looks like.
He does, he does. But he's got a huge donor area as well.
In the back.
Yeah.
So that means it didn't drop all the way down in the back? Is that what we're talking about?
That's it, exactly.
Okay.
Yeah.
So you take a guy that's completely bald, you do this, and how many treatments for this guy?
I believe that this fellow had 2 today. We'd probably do it in 1.
So when this is done, what does he say?
Well, you know, if you look at a fellow like this, and not particularly this fellow, but a fellow like him, and we see a lot of these types of people, you know, it really makes them feel great. You know, it can change their life. In the work world, definitely, it adds confidence. A lot of my patients are in sales, or, you know, I've had 1 or 2 celebrities who had hair transplantations and hit it pretty well. And you know, that's another topic.
Yeah.
Is when does the hair come in? You know, it takes a year for it to come in. For a lot of people, that's a good thing. You know, it just gradually comes
Slowly.
out. Yeah, and their look gradually changes.